Here in the summer, we are in a critical blood shortage, and more than ever, the Red Cross needs donations. That's why I'm so excited to have Garrett Reid here with us from the American Red Cross. Can you just tell us first what's going on?
So right now we are in a unique time, a time we don't really ever want to be in at the Red Cross, where we are in an emergency blood shortage. And a big part of that has to do with 25% fewer donations in the month of June. People busy, they're going out, they're going to barbecues, kids are out of school. And then we've also had a higher than expected hospital demand. So we have been kind of a little over our skis a little bit in how we're able to provide to our hospitals. So we're appealing to the general public to say, this is an emergency need. We need the units now, and it is all unit types. So we're sending the message to make sure that none of our hospitals go without.
It's so important to make sure that they're prepared and ready for an emergency. What does it mean that some blood types are just days away from crisis levels?
Great question. So I'll give you a little bit of a behind the scenes from a Red Cross perspective. So we're monitoring our inventory on a daily basis, and we're managing it across a national inventory system and as well as regional statewide systems. And what we're forecasting is particular for O positive and O negative. Our distribution with the hospital demand is so high and our inventory is not where we want it to be. So we are getting into an emergency release situation where if we do not have those blood products and we're unable to replenish our inventory, those units are going to be at an absolute critical need, and that is something we're really looking to avoid.
Yeah, that is scary. You mentioned the O blood type. Can you talk a little bit more about why that's so important?
Absolutely. So we have O positive and O negative. Our O negative is our universal donor. Really cool blood product because any person walking down the street is going to be able to receive blood for you as an O negative donor. But one of our highest demands is actually O positive. And the reason for that is the majority of the U.S. population is O positive. So having that unit type available is a really high demand because it's usually one of the first ones off the shelf, right? So I'm AB positive as an example. My inventory or my needs are probably a little bit more prevalent, but for the majority of our listeners, they're O type. And so with that inventory type going low, we don't want to be in a situation where someone has an injury or an ailment and that unit is not available.
Can you talk about how this shortage is affecting hospitals and patients who need transfusions?
That is a great question, and you're asking me at a great time. I was just visiting with a local mother here in the Atlanta metro area who was giving birth to her son, and in that process, she lost 2 measurable liters of blood.
Oh my gosh.
It was an extremely difficult and serious situation, and as I talked to her, she's talking to me about her child who's now 3 months old, taking their first steps and crawling and walking. She's going to be there for her child. The child is going to have a mother. That to me is like the perfect way to describe it. Is the blood inventory system may not seem like something top of people's mind on a daily basis, but it could affect you. It could affect your family members, and it has a ripple effect. So just the patient receiving the unit is great, but all of the people that they know and love are also being affected by those donations. So it's a very clear example of we would never want her to not have units on the shelf in her time of crisis.
Yeah, gosh, that's scary. What about the number of people donating? What are you seeing in terms of trends of who is donating and how often people are doing it?
Great question. Love that question. I will note this. In Georgia, it may surprise people to know that about 23% of all the blood we collect and transfuse to patients on an annual basis comes from high school and college students.
Really?
Very interesting.
That is fascinating.
And I love that fact. I love that statistic. That generation is extremely giving when it comes to blood drives. So we're not seeing them at school. We're not seeing regular school blood drives. So that's been a part of the dip. But also, we've just noticed a little bit less of the consistent donor behavior. So I think it's just been a really busy summer, especially here in the Atlanta area. We've been dealing with the World Cup and all the barbecues and family and vacations. So right now, we really are appealing to our donorship to say, please come in, roll up your sleeve so that we can help save lives together.
And who can donate blood or platelets, and are there any misconceptions about eligibility?
I get 2 misconceptions quite a bit. So the ages is one that comes up a good amount. So the age in Georgia is 16 with parental consent, and so you can start donating blood as young as 16 years old. Another one that I get is that you may be too old. There is actually no upper age limit. It has to do with your health and how you feel. We've had donors in the 90s that I've interacted with.
Yes, I love that.
Right, they're healthy and well enough to donate. But one of the the things that I always encourage people to do is don't make an assumption of whether or not you're eligible or not. I recommend calling 1-800-RED CROSS, and one of our talented and trained staff will be able to help verify if you're eligible or not. But typically, it has to do with medication.
Yeah, that makes sense. How quickly does it go from donation to helping a patient in need?
So right now, I would say the unit is lasting on the shelves for about 48 hours.
Wow, that's really fast.
We are seeing a very tight turnaround. Some of our blood product types, like platelets, like you mentioned, have about a 5 to 7 day shelf life, so they have to be used very fresh, and we have to use them quickly. But when we get into this emergency inventory situation, it takes about 48 hours for us to process test every single unit to make sure everything is safe for our patient that's receiving it. And then at that time, we release it into the blood supply at about 2 days after the donation, and we see it be transfused at this time within usually about 24 hours after distribution.
That is really fast and just
It
speaks
is.
to the need. If someone's thinking about donating, why would you tell them to do it now?
I would tell them to do it now because it is a demand. It affects all of our communities. As members of the community, as a member of the community myself, I don't want to be in a situation where I wouldn't get the best health care possible. And we have incredible health care providers across the state of Georgia and Atlanta. So I want to make sure that they have the tools that they need to be able to perform the best health care. And so now is as urgent as it gets. We are doing $15 movie gift cards for the remainder of this month, and then $20 gift cards next month. So we also have a thank you, and then of course the juice and cookies, and come out
Right?
and say
Come
hi
out for
to
the
us.
juice. Give me some apple
We
juice.
have amazing staff that are very talented and very skilled, and we'll make sure you have a great experience.
Where can people go to donate or make an appointment?
My recommendation is to go to redcrossblood.org, or you can call 1-800-RED-CROSS, or my personal preference is to download the app. It's on the Google Play and the Apple Store, and you can download the blood donation app, and then you can make your appointment right there. We're running about 30 plus operations a day across the state, so
Wow.
we would encourage you to find something that's close and convenient to you, and come on out and see us.
How often can people donate blood?
You can donate every 56 days with a standard whole blood donation. And then for other donation types, which would be including like Power Reds, that's about 112 days. And platelets would be 2 weeks.
All right. Really good information. Thank you so much for joining us. I really appreciate it.
Thank you for having me.
Absolutely. Again, the Red Cross in a critical blood shortage now, really encouraging people to go out there and donate, make sure that the health care you need is available.